to the office.
Thank you.
How can I help you?
I come in this place because I have a lot of pain in my legs.
Okay.
So,
In both your legs or specifically in one leg or the other?
so for now it's more here.
Okay.
Here it's a little bit because now, like more in these legs.
You're
like
you're using this side
Yeah,
more
more.
because this hurts.
The left, yeah.
Okay. When did all this start?
6 months ago.
What happened 6 months ago?
I'm washed the bathroom, so
Okay.
I don't have shoes. So my phone is ringing, and so I come into.
You were washing a bathroom and you slipped? You fell?
Mhm.
You fell on your back or you fell on your front?
No, I fell in my back.
You fell back, and that was about 6 months ago, you
Yeah.
said. And from that day of the fall, you started to get pain in your back or your legs first?
First on my back,
Okay.
and after a couple days more, so the pain coming in this side. So
Okay.
now I can walk exactly right.
Okay.
So I have a lot of pain for I can walk too much. I can stay like for a long time.
So 6 months ago, you got the fall in at work.
Yeah.
You hurt your back. It started on your right leg, and then did it switch over?
Yes.
Now it's in your left or it's both?
More in the right.
More in the right. Okay. What makes it better? What makes it feel better? Hielo? Calor? Or
Something.
everything is the same?
Everything. 24 hours I have a pain. I need to drink ibuprofen in the morning
Okay.
and one in the night for sleep.
Okay.
So
Did you
I
see?
don't want to drink more medication.
No, wait a minute. Did you see any doctors for it?
Yeah, I go to the doctor and the doctor say, take me MRI and everything. Say, oh, maybe it's arthritis.
Hold on. So you went to see a doctor. They did an X-ray first or MRI?
MRI.
MRI.
Yeah.
They didn't do an X-ray.
No.
Okay. And on the MRI, they said you have what? What? Why is the pain there?
He told me arthritis.
But arthritis comes from the fall?
He
No,
told-
I'm asking you. It doesn't. So
I don't think so.
arthritis didn't come from the fall.
No.
So the question is, did you have arthritis there, and did the fall make it worse? I don't know. We're gonna take a look at it. Okay. But I don't know that a fall, and you had the image done. How long after the injury you had MRI done? 1 month after?
Yeah, 1 month after.
So I don't see that arthritis came from a fall of 1 month. Can it lead to arthritis in the future? Sure. But, and that's the number one reason why you're here? That's why you're here?
Yeah.
Any other problem? Any other
No.
issues? Okay, I got it. So you don't really know what I do?
No.
Okay, I am a chiropractor. I am a
Okay.
very specific chiropractor, a Gonstead chiropractor.
Okay.
And I'm gonna look at everything for you.
Okay.
You came for your hip, I understand, but I'm going to explain everything, okay? I'm going to focus on your hip. There is one thing I need to show you on your x-ray, okay? It's not good, it's not bad, it's just what it is. It's a transitional vertebrae. You're in the spine, we should have 7 bones in the neck, right? Siete? 22 in the mid-back, 12 bones in the mid-back, thoracics, 5 bones in the low back, lumbar, and then we have the sacrum, tailbone. Yeah. In your lumbar, you have actually 6 lumbars, not 5,
Not fine.
because your sacrum became the S1 became L5 or L6. It took on the characteristics of your lumbar, and there's nothing for me to fix it. I have to point it out to you. And there's a spot, if I push, is gonna hurt in your back, and I'm showing you why. It's not the problem, but I'm showing you that it will hurt when I push. Okay, so that we're clear on it, but that's not your problem. I'm just pointing it out because down the road, I'll give you 1 or 2 simple ways to strengthen that back, because you have more flexibility, so you need a little more strengthening in the back. Does that make sense?
Yeah.
Someone who has, I have patients who have 4 lumbars, not 5. That person is very stiff, and that person needs more flexibility. That's not your case. I'm just explaining the difference.
Okay.
Does that make sense?
Yes.
Now, I do want to mention before we start, if you don't understand something I'm doing, if something doesn't feel right to you, just stop me, okay? But the number one thing, I need you to understand what your problem is, then it's easy to fix. If you don't understand, then you ask me until you understand. Okay?
Okay.
Entiendes?
Yes.
Sí.
Okay.
Is there anything else going on that that you want to talk about? Otherwise, we get started.
No.
Okay, let's get started. So basically, you're working, you fell, it hurts, it's been 6 months. Boss said, go see the chiropractor, found me, and here you are.
Mm-hmm.
And you need to get back to work without pain, right? Stand up for me, please. Caminas, por favor. Before you start, let's take a look. And I want us to focus here on the dimples when she walks, and they should be going like this, okay? So go ahead and walk for me, please. I mean, you can see she's favoring a lot. Walk. It's on your
You're
right
coming
side.
like that. Yeah.
Okay, go ahead and walk for me. So the pain is all on your right side. So is there more pain when you step on your right leg or take your right leg off?
Same thing.
Same thing,
Yeah.
okay. Is there more pain when you lie down, sit, or walk?
What?
Okay, keep walking, please. Turn around one more time, and we're gonna get started. I got it. Okay, come over here. Starting at the base of the neck. Starting at the base of the neck. Neck is good. Now, watch this on the meter. It looks like it's going to break. There. Keeps going, comes back there. So it does go left. It looks like a break, but it actually breaks on the right side. Same level though. All right, let's continue. Interesting. And now it's going to go to the right and come back. Good. That's where it is. S3, S4, down low. Alrighty. So we're getting pressure first around T10. It looked like it was on the left side. It's on the right. And it's a small one. It's an old one. It's interesting she talked to us about this allergic response. The first part is following the T10 distribution. And whenever historically we've been taught the neurology of allergies or the physiology of allergies is always look first to the adrenals, because the body's not able to fight whatever those allergens are in the body. So T9, T10, this area, part of the control of the adrenal glands. And she mentioned that there's some allergic response here to something you ate, you said?
Yeah.
Okay, so maybe it's something in the digestion, but also could be something in the adrenals relating to, we're not treating allergies as such, but what is it? Body's not used to the allergen, and so it produces some sort of reaction to it. And we're getting 10, 15 points down low. So I'm getting down low in your tailbone here.
Mm-hmm.
Pressure here, here, and here. 3 spots. 1, 2, and 3. Okay?
Mm-hmm.
Come forward a little bit. And then you're going to open and close like this. Then I'll say solamente derecho, solamente izquierda. Okay?
Like that?
Right now, both. Yeah. Okay? And I'm checking in the back your movement in your joints.
Okay.
All right. Derecho solamente, por favor. Izquierda solamente, por favor. Slow it down, little slow. Right side. ¿Esta duele? Aquí.
Yeah.
Mucho duele arriba, aquí o abajo. Arriba o abajo. Abajo,
Yeah.
okay. Mucho duele arriba, aquí o abajo.
Abajo.
Abajo. So, abajo, both sides. See?
Sí.
Okay, para atrás. Sit back all the way. There you go. Sit up straight. So what she's telling me is both of the bottom parts of the SI joints in the SI joints at the PSIS's inferior aspect are tender. They're both moving decent. The right may be a little more fixated, but what I'm seeing is your sacrum. Mira. Back slowly. Número 5. ¿Duele?
Yeah.
Sí. Sacrum, número 1. ¿Duele? Mucho
Yeah.
duele abajo
Yes.
o arriba.
Abajo.
1. Número 2.
Yeah.
Mucho duele número 2 o número 1. 2 or 1.
1.
2 or 3.
3.
3. So it's starting at S3. Now, one more time. Número 3. Aquí or número 1.
Número 1.
Número 1. Duele.
Yeah.
Número 3.
Yeah.
Duele? See,
Yeah.
there it is. Okay. That's as hard as I'm going to push, okay? We just have to make sure. There is S1. Now, here's what's interesting. I said S1. S1 is actually your L6. I'm going to explain it on your x-ray, but first I want to count here. 1, 2, 3, 4, 5, 6, 7, 8. 9, ¿duele o 10?
9.
9?
Yeah.
Sí, 9. 9, S3. And let's check up top for you. Let's check C7, C6, C5. 3, 2, aquí.
Yeah.
No, not as much.
No.
Okay.
Yeah.
Left atlas T9, S3, or in her case it would be S2. Come over here so I can explain your x-rays. Over your x-rays, and I want to explain a couple of things. I'll go in more detail later. Right now you're hurting, you're in pain. So I'm not going to spend so much time. I'm going to go straight to the problem
Okay.
of what it is. Then next time when you have a little less pain, I'm going to go in more detail for you.
Okay.
Is that okay?
Yes.
All right. And the reason why is when we're in pain, we're in fight or flight. Fight or flight, first thing that shuts off during fight or flight is what? Memory. You don't need it. So you tend to forget a lot of things when you're stressed out. Fight or flight could also be your perception of stress. Okay? Now, in your scenario, I wanted to point out a few things. We said we have 7 bones in the neck. You have 12 in the mid-back. Here's what it is. You have L1, L2, L3, L4. This is your L5. This is supposed to be the sacrum S1. It's now L6. Okay, and you have what's called, this is why when I said S1, it was hurting. This is called the spinous process. These are the bumps on your back. This is the lamina, this piece here. Okay? They formed during birth when you were inside mommy's tummy. It goes like this, and it closes.
Oh,
Yours didn't close there.
it's open.
It's because mama didn't have enough folic acid during
Oh.
pregnancy. It is what it is. It's okay. But it's still, it's closed, but you can see it's not fully closed like the rest of them. See? See? So with that, anytime you push is gonna hurt. And I'm glad we have an x-ray, because without an x-ray, you start poking in there and the person's gonna say, hey, it hurts, so let's adjust it. That's not the problem. The problem is actually lower down here. So this would be S1, 2, 3, 4, 5. But because this is really S1, right? This is really S2, S3, S4, S5. Okay. So we're gonna work on this one here. Okay?
Okay.
That's the one we're gonna work on. And that's where we're gonna start to get now. When you look at the nerves, it can be from any of them. Okay, but where we found the pressure was there. S3, but it's really S2. Okay? The second one we found was at T9, but I do want to go over these x-rays now and talk about the foundation. When I look at your foundation, there's a lot of good news. It's good. So we have a little bit of misalignment, but it's not a major. AS2, EX1, and 1 millimeter rotation. So I'm not so, your sacrum, your foundation is balanced.
Oh.
Decent, it's good. All of this is starting, we have to get this tailbone sorted out. Once we get this fixed, we're gonna see what happens here. And the reason why, you see, you have arthritis, but your arthritis is here. See? And you can see it wants to fuse here. So you have a lot of stiffness in your back. You work very hard.
Yeah.
You work very hard most of your life. I get it, okay? And this, probably you had a lot of spasm in your back before, years ago.
Yeah.
You had a lot of pain here?
Yeah, before.
Before, okay? So this stuff, I'm not trying to fix that. What I'm doing is we'll focus on why you came, what I found, and then we'll see what happens. I'm gonna see you 2 or 3 days. Okay? And in those 2-3 days, we'll see what changes will happen. Does that make sense?
Yeah.
Now on this x-ray, I have lots of good news. Even though you have this, you can see the arthritis. That is the arthritis. In the hip, maybe. Could be. But does that cause the pain? No. Your disc is good. Your discs are good. That's the good news. Your discs are all good. Yes, you have some calcium arthritis, but your discs are good. Your neck, this was an old injury here, whiplash. Old accident you had, yeah? So your discs are good. I'm going to talk to you later about getting your curves back with a couple of simple exercises besides what I do here. Okay, madam?
Yeah.
Shall we get started? You ready?
Yes.
You sure?
Yeah.
Okay, let's start over here. You see one, AS, L. There we go. Left ear down. No. Let's go on the gray table there. Okay? Home run. Gotcha. Head down, please. S3. Or S2, I should say, since we have that spina bifida. Good. Respire. Sáquelo. Otra vez. Sáquelo. Respire. Sáquelo. Respire. Sáquelo. Bueno, relájate. Shoulders, relax there. Bueno. Perfecto. Bueno. That was deep. Good. Good. You okay, Thelma?
Yes.
Okay. That was very deep. Now, you're gonna hold my hand, please. Come off slowly. Okay, let's walk, please. Okay, let's go back on the gray table and do número 9. Boca abajo, por favor. 2, 3, 4, 5, 6, 7, 8, 9. ¿Sí?
No.
9. Número 9. Good. That's it. Walk it off, please. And as you're walking, Thelma, tell me if anything is different now.
Yeah, a little bit different.
Meaning less pain or easier to walk?
Well.
A little easier to walk, yeah? Good. Okay, come back over here, please. Let's have a seat. Let's run the meter on the back and let's see what we find. Starting at the base. C1 is clear. Zero. T9 is clear. Zero. I got a little heat there, but I don't have break. Let's recheck. Back slowly towards me. Cinco. That's S1. S2. S3. Diferente?
Yeah.
Come back towards me, please. Back. Now, I didn't touch S1 or the spina bifida. Is that different?
Yeah.
Aquí. Poquito mejor.
Yeah, poquito mejor.
Same or poquito mejor?
Poquito mejor.
Bueno. Okay. Now we're going to use the machine. Now I want to work on your feet. Boca arriba, aquí por favor. Fantastic. Aprieta. Poquito.
Yeah.
Poquito. Aquí. Aprieta. Poquito más. Posterior humerus. Posterior ulna. Posterior lunate and thumb. Squeeze. Squeeze. Okay, that's where we're going to start.